Hello and welcome everyone to another of our conversations with pathologists in the theme of why I love my job. And now we don't always work with the delicate arch in the background. More often we're more like our guest today, who's in an office with a microscope and surrounded by family and mementos and so forth, and great material to work with. My guest today is Dr. Leilani Valdes.
Yep.
Valdes, and I'm really excited to hear what she has to say about her career and so forth. So, Leilani, why don't you introduce yourself and let us know a little bit about how you got into pathology? How did it come into your life?
Thank you, and thank you for this opportunity. I do love my job, so it's really nice to have kind of a platform to be able to talk about how much I love my job and why I love it, right? So sometimes other physicians in the medical community may not like to hear that you love your job all the time. So I'm glad to have an audience to be able to talk about it and give you some of the reasons why I really do love what I do. You know, as a pathologist, you know, it's wonderful because on any given day, I might diagnose disease, figure out with a colleague how to monitor the disease progression, provide treatment information to other physicians, and you know, or find the right blood product for a patient who's in the ICU at my hospital. So what I really, one of the top things I love about it is that I don't know what I'm gonna end up with on my desk every day, right? There's somewhat of a routine. I know I'm gonna get a certain amount of glass slides coming to my desk in folders at around 8:30, 9 o'clock. But there are a whole list of other things that could pop up and just make your day more interesting. So it's really great to sort of have a little bit of routine, but a lot of really good surprises where you can find that you're helpful to somebody else. You're going to be helpful to another physician in your hospital. You're going to be helpful to someone who's working in the laboratory, and ultimately you're helping a patient, right? So it's really great, and I really enjoy that. But I didn't get here and know all my life that this is what I wanted to do. So how did I get here? It's a pretty long story, but I'll try and keep it interesting. I liked science and math in high school, as a lot of physicians or students who think they want to be physicians do. But I also liked theater. And so when I got to college, I decided I was going to be a theater major, and I added an English minor for good measure. And I was very lucky to have supportive parents who said, "That's great. If you can find a job after you're done, we're okay with it. It's fine." However, I did grow up the daughter of a pathologist, so I knew what a pathologist did, right? And just because all the people in my life were saying, "You're good at math and science, why are you doing the arts? You should be a doctor," I was like, "No, I don't need to be a doctor. I can do this other thing. And I like people, so, you know, it fits and it's great." But all that to say that my summer job home from college, when I'm working, I had to have a job to sort of do something, but I also wanted to do community theater. So by day, I would be a phlebotomist working for my dad. And in the evenings, I go to the theater and do rehearsal. So I kind of kept that exposure. I got through college and I realized, you know, I don't know that theater is the right fit for me, but I had learned to write really well, and I had done some marketing for different arts organizations, so I ended up in PR and marketing. And I did that for a while, and it just took me a little while to realize that just because you can learn to be good at something doesn't mean it's your calling or it's what you want to do or what you're going to feel good doing every day, right? So I was writing a lot on deadline, and I just didn't love it. And I had gotten married, and I was kind of sitting at my desk one day thinking, I was like, you know, I liked science and math. Maybe I should do that. And sure enough, I decided to work as a candy striper at an ER, mostly because I lived in LA at the time, and Friday night traffic was terrible getting back to our home. So I took the 5 to 9 shift in the ER working as a candy striper to see, is this really something I want to do? And sure enough, after I think my fourth shift, watching them restart a patient's heart in the ER, I was like, oh my God, I'm doing the wrong thing. I got to do this. So quit my job, go back to school, do all my pre-meds. I'm a newlywed. My husband's like, yeah, it's okay. Surprisingly, he was a champ through it all. And I decide, this is right for me. This is what I want to do. I want to be a doctor. But I'm a people person, so there's no way I'm going to be a pathologist, because I know my dad is a pathologist and he was a great pathologist, a great doctor. But, he's not an extrovert like me per se. And so, pathology is not going to be what I do, but definitely medicine. So I got that far. And then I went into medical school and I'm like, okay, I'm going to try everything. I'm going to try OBGYN, surgery, family, you name it, I'm going to go all in and I'm going to figure out what's right for me. Well, I had I think it was the last year of the traditional pathology curriculum, where you get a full histology course where you're looking in an actual microscope at glass slides of normal tissue. And then in your second year in pathology, you get the tumors. And I had a little study group of, two of us were children of pathologists, and the other two, no family ties to medicine at all. And we all really worked well together. We had one other, I had kids when I started med school, and one of the other students had kids when she started med school, and we studied really well together. And the two pathologist kids would be in study group, and we'd put up a Kodachrome image of a tumor, and we'd be like, oh yeah, that's a blah, blah, blah. And the other two would look at us and go, how do you know that? How can you see that? We're like, oh, it's so clear. I mean, the pattern, the way that, so what I started to realize is that there really is something about your ability to recognize a pattern. Right? And so then I started trying to connect things. And then I realized, okay, that art history class I had as part of my theater major, where I would walk out of an exam and everybody's like, what was that one? I was like, oh, it was a Monet, because it was this subject matter and this brush stroke and these colors. And they're like, had you seen it before? I'm like, no, but it's all his patterns. It's the same idea. You're looking at a picture, you've learned all the different things that go into that pattern. There is learning there, right? You have to acquire that knowledge of what types of things can go in to make that pattern, and then you apply it, right? And I enjoyed that. I thought that was cool. I liked that, but it didn't matter. That was first and second year. I went into my third year rotations. I said, I'm going to love something other than pathology, because I'm a people person and I got to see patients. I got to see people. And I went all in on my rotations. I made the most of it. I tried everything. I did every call I could possibly do. I delivered babies. I scrubbed in on surgeries. I did them all. And I was in one of my surgery subs, and I realized as they were taking the tumor they excised and taking it down to pathology, I watched myself kind of go like this. I wanted to know what we had taken out. I wanted to know what the margins were. I wanted that information. And I had to allow myself to be okay with the fact that pathology was going to be the right fit for me. And the truth of the matter is, I talk to people all day long. I'm not in here, the door's closed now because I'm talking to you. But I have people going outside of my door into the laboratory. I'm constantly talking to other clinicians about their patients. I talk to people all day long. I just don't talk to patients. But because I don't see patients directly, sometimes I do. Sometimes we do an FNA or a bone marrow biopsy or something, and I see a patient. And but it's not routine. We actually can affect more patients' lives on a daily basis. I feel like I'm part of patient care for more patients, a bigger population of patients, because I'm not actually seeing them face to face. And that's really cool, right? I mean, because that's the other thing that we go into medicine for, is to help people and to improve healthcare and improve outcomes. And it's one of the really exciting things I enjoy about the practice of medicine, right? There are plenty of things that I'm sure med students understand that don't make our jobs any easier, right? Some electronic medical records, not so great, payment, all these other issues. But if you find that reason that compels you to go into work every day and to do a job you love, which I fortunately was able to find, kicking and screaming, right? wasn't what I thought was going to be right for me, but it ended up being perfect for me. Day to day, I get to help people. I get to recognize patterns under the microscope, and really, ultimately, it's solving problems every day. And you don't know what the problem's going to be that day. You can count on a few routine problems. I ended up doing a fellowship in skin pathology. And so I can pretty much count on at least one squamous cell or squamous cell carcinoma of the skin or basal cell carcinoma of the skin on my microscope every day. Other than that, who knows? Who knows what it's going to be, right?
Yeah.
And, the beauty of kind of the postgraduate path I took, right? So I did a general APCP residency, got board certified in anatomic pathology and clinical pathology. And I did a fellowship, 1-year fellowship in dermatopathology. But I chose to practice in a community setting. I'm in Victoria, Texas. It's a relatively small town in South Texas, about 80,000 people. I work at a 300-bed hospital. And I do everything I learned to do in my anatomic and clinical pathology residency and my fellowship, at least once a week, right?
Yeah. Yeah.
I manage the blood bank. I signed off on proficiency testing in the clinical laboratory. I serve as the medical director of the laboratory. I diagnose plenty of cancers, not just skin cancers, breast cancer, colon cancer, prostate cancer. I have colleagues outside my door that we share cases with each other so that we can make sure that we're making the right decision for that patient. And I love that diversity. And one thing that I worry that medical students maybe don't understand when they're looking at pathology, because usually they train in academic medical centers, is that if you're in the community and you're a pathologist, it's kind of like the family practice of the primary care world, or the adult medicine world, right? We are the starting point. We're the triage point, right? And we have to be astute enough to know when we need to get help, right? So there are people who are way smarter than me in pathology that will know the very, very minute details about a disease that I just may not know. But I got to know when I need that person. And in order to do my job well, I got to throw my ego out of the way and say, hey, I either know what it is or I don't. And if I don't, I'm going to get help, and we're going to find the best answer for this patient so the patient can get what they need.
Well, Leilani, your path here is just so remarkable, and your enthusiasm is just infectious for what you're doing. And I think you've made a couple of very unique points. One is that, a lot of people like you sort of come into pathology thinking that's the last thing I want to do, or they discover it after they've tried other things. And then sometimes that's good because those other things add diversity and perspective and so forth. I'm sure you still use your theatrical skills. Tumor boards are probably not the same in your institution when you're not there.
Yeah, that was given to me as I got to this job. I started 11 years ago now, and they said, we're going to need you to present a tumor board. And I remember someone saying about 6 months later to my dad, because I joined his practice initially, boy, Dr. Valdes presents a tumor board. She gets up there, and yeah, you can't take the thespian out of the position, unfortunately. So we find our opportunities to be on stage, and tumor board is a great example of that. Yeah,
and you're right. You leverage your efforts into a lot of patients' lives that otherwise, you may not see them or know them personally, but your care for them is still palpable in the way you approach your work, whether it's an individual slide or an individual blood smear, or even just setting up the new procedures and so forth.
You do, and when you build relationships with your clients, the other physicians who have that contact with the patient, they'll express that to you. They'll say, "Man, you really helped me. Thank you." And I've really tried very hard to develop a relationship with the other physicians who work in my community so that they know that they can call me, and I may not know the answer, but we can work together and try and put two and two together to either find the right diagnostic test they need for their patient or troubleshoot what it might be. And sometimes just a conversation with someone else who understands pathogenesis of disease in the way that pathologists do will trigger something that then will help them figure out what's really going on with the patient. So that discovery process, helping another physician do that, it's huge. It's part of that teamwork. And we may not have, this day and age, as many well-orchestrated outlined teams, multidisciplinary teams that get together on a regular basis to discuss what's going on with the patient and put together a patient plan. I think that's coming with what you're seeing in cancer diagnostics and treatment and that sort of thing. But I have many multidisciplinary conferences all the time, every day, with the ICU physician trying to figure out, why a patient had a certain reaction to a blood product, or what the new biofire panel means when we get more than one entity that's popping up, right? When we brought in procalcitonin as a marker for sepsis, does it work? Does it really correlate? Let's look at a study. Let's follow all our patients and see if we can really trust it. There's all sorts of ways you can collaborate. You can choose not to as a pathologist. You can stay in your office and sign out cases all day. You can do that too. So if you enjoy just that piece, there's a job for you. But if you like the other part of it too, there's plenty of work to be done in a hospital setting. And if you put yourself out there and start building relationships with other physicians, I loved it as a pathology resident. This is a great story. I was a pathology resident at LA County Hospital, and I'd done my med school there. So because I was all in on all of my rotations, including the ones I did after I decided on pathology, I got to know the residents who, and those hospitals are resident run. So I got to know the residents and interns really well as a med student. So by the time I was a resident in pathology, I had built these relationships with all these other residents in the departments. So when I saw a resident's name on a case, I would call them up and say, "Hey, remember me from the surgery rotation or the urology rotation?" Because we'd see each other in the physician lounge or whatever. And you can start at that point, right? Even in your residency, building those relationships. And then you just sort of pick that up and apply it wherever you land for a job. And you say, it's harder now with COVID. Please, but my dad was really great about this. He would tell me, we're going to go to the doctor's lounge, every day. Like, he's like, I go twice. I go once around 11:30 because that's when you get to see the surgeons. And then I go again around 12:30, 12:45 because that's when most of the internal medicine people are in there. My maybe less introverted father understood how we could provide value to the physician community. He loved to visit with them because they're always telling stories anyway. But the amount of times that we could help them just sitting down at a table discussing a patient they have, you learn from that, and they start depending on you, or at least they trust you, right?
Yeah.
And you feel good about that because then they'll tell you, you know what, you told me about that patient, that really worked for them, or we tried that, and thank you, and that feels good too. You don't have the patient sending you flowers or bringing you baked goods, but there is gratitude out there for the work we do.
So you haven't talked a little bit about some of the work with the personnel in your lab, which is another area where obviously your influence projects very strong. Tell me about some of the interactions you have with your lab personnel and what kind of fulfillment that brings into your life.
So that's the other thing that med students may not realize is that the lab is made up of some very well-educated scientists, basically, right? So lab techs are sometimes have more education, or at least a longer technical road to get to where they are today than even nurses, right? So, they're kind of maybe that equivalent to us, the lab technologists, to the nurses as far as helping with what we do. But people sort of realize, even med students realize, they're all the lab, it just gets done. Well, there's a small army of people getting it done, right? So, and these people are smart. They're really smart people who, little mini engineers, mini scientists, right, who are expert at what they do. And I'm privileged to work with a bunch of smart people who just need a little bit of guidance from me, in the way that a nurse doesn't necessarily go through medical school. A laboratory technologist doesn't go through medical school. So our background in medicine will help them do the technical work they need to do to make sure that the results they're putting out for the staff managing the patients can be trusted and is valid and is useful, right? And so what people don't really think about is the lab is made up of an army of very smart people with a physician, a pathologist, who's a physician, guiding them, right? So there's a lot of interaction, and it's really a two-way street, right? I'm not going to be able to sit down at the micro bench and plate out a bunch of bacteria, right? I did it once or twice, but they are expert at it and they do it day to day. So we have a dialogue all the time. They'll come to me with a problem. I'll say, okay, let's think about it. Let's troubleshoot where we're going wrong. And it's more problem solving, right?
Yeah.
And you do it with another group of really smart people who really care about outcomes and patient care. That's why they're doing this, right? Maybe they didn't, maybe they cared about patients, but they didn't really feel like they would be comfortable with patients. Well, laboratory is a really great place for smart people to work and do good work on behalf of the hospital. And they're really, they're under-recognized. I like to say to the lab staff, and anybody else will hear me, that, in the laboratory, we're always the first to be blamed and the last to be thanked. But that's okay, right? We understand that. We understand our role is important. But and I tell them all the time too, a physician may be really upset that their result is not right, or the lab test has not come back yet. I tell them, tell them to call me, right? Let me hear them out and apologize and take that off your shoulders, because I can do that physician to physician better than you can. And I feel like I can do that for them and give that to them and be their support and buoy them, because we first to be blamed, like, where's the test, what went wrong, or whatever. And and when a patient's better, you look at the nurse and you say thank you, and you don't think about the army of people that made sure that that right blood product was matched correctly to save that person's life, right? Yeah. So that's okay, and it's okay. It's not maybe the best, but if you recognize that that's going to be the scenario, you find ways to sort of make sure that as a group we stick up for each other and we support each other, and because we're really the backbone of the hospital. I think everybody likes to talk about that study that was done that said about 70% of medical decisions, right? So a physician or a nurse practitioner or PA is making a decision on what to do, how to treat a patient. 70% of their decisions are based on data provided by pathology and laboratory medicine. Yeah. Not the physical exam, not radiology, but by what happens here in the lab. So that's a lot of weight to carry.
Yeah, yeah.
But it's good. We're glad to help.
Well, it underscores that that we're really it is a system-based practice that we're working on. We're not solo individuals. Even if we're in a solo practice, we're part of a group of laboratory professionals and other network of people beyond our walls, as you mentioned, consultative help and so forth, that really unites us into a process of providing for those patients. So, Leilani, you obviously tackled medical school when you were already a mother and entering into a family life challenge and so forth. How does pathology fit into your life balance with other interests in your life, whether it's theater or obviously your family and spouse and so forth? How is it meshed with those parts of your life?
Well, it's been great. I mean, if the job itself weren't perfect for me, and it is, kind of the lifestyle really works, right? So I started med school with a 4-month-old. I had another baby in 3rd year, and I had my 3rd child at the end of my 2nd year of residency. And I'm a little bit grateful that I decided to take a little, side path and then had to go back into medicine, because part of me thinks that if I had committed to medicine in my early 20s with all the energy I had then, I probably would have ended up in surgery, because I would have just put my foot down and said, I'm not doing pathology because that's what everyone thinks I'm good at, right? So fortunately for me, it was a little bit of a delay so that I could really put my hat on and say, okay, what's important long term? And so it really allowed me to consider it, right? And keep my mind open to it, because as much as I did love surgery, I was looking at that tumor walk out the door. And, it's a little bit of an easier lifestyle, pathology residency, than general surgery or even urology, which was the other thing I was considering. And residency is going to be tough whatever you do, and it depends on where you go. But for the most part, pathology is going to be a little more reasonable than most other residency programs out there. But then the practice is, you can choose whatever practice fits your lifestyle, right? I have plenty of pathology colleagues who really like to be busy all the time and don't mind being called in, and, and they work in a really hectic, fast pace. I love being in a community hospital where the pace is just right for me. It's busy enough. I chose a small town. I grew up in a small town, but it was really important for me to be able to pick up and go to my kids' school while they were little, and either eat lunch with them or see a performance or, whatever I want. I could be part of their life, right? I wasn't in a clinic seeing patients all day. I could take a break from my microscope and step away. Beauty of my small town is that nothing's more than 5 minutes away, so you're always available, and you park right out front. You don't have to walk to your car and all that kind of stuff. So it's all good. So you can pick a lifestyle that suits whatever else you have going on or want to have going on in your life. I raised my kids. My kids are now big. They're 20 and 17, almost 18 and 14. And they may need less to show up. But even while I was raising them when they were young, we have a great community theater here. So I have done some actual real theater, not just the tumor board. So I've been in a couple musicals and danced in the Nutcracker with the ballet when my kids were doing that. And so I just don't know that if I had a practice full of patients, I could have that kind of flexibility to do that. And then the other thing that's been really great about the flexibility of pathology is that it's allowed me to do some more advocacy and sort of promotion of the specialty. I got involved with the College of American Pathologists and am on committees for that organization to promote and advocate for good patient care on behalf of pathologists. And, it's harder to do that, to be active in organized medicine when you're so busy doing medicine all the time, right?
Oh,
So
absolutely, yeah.
It has a lot of advantages lifestyle wise, and flexibility wise. And, more and more, I think the number goes up almost by 10% every year of physicians are being employed, right? So as you look at employment, as sort of the paradigm for physicians in the future, you want to choose one that, your employment agreement isn't going to have you on call every third night, right? Usually pathologists are in groups of 7, 8, or 9, and you take a week of call at a time, and knock on wood, I've been called in twice in 10 years. Call from home, troubleshooting or whatever. So, and every practice is different, but I think there are enough options and enough flexibility that you can find whatever is going to be the right fit for you.
Yeah, I think that flexibility is one of the great things about pathology, is that there's so many different niches and so many ways that the life and the work can be adjusted to meet individual needs, and yet still have such engaging problems and meaningful interactions with patients, colleagues, lab staff, and so forth, that it's just, I think it's a wonderful profession. So let me ask you one additional question about what your advice would be to somebody who's starting medical school now. How would you recommend that they approach this decision about, should they even consider pathology? I mean, some people say there's no jobs, or there are too many jobs, or there's too many risks on the downside in terms of technological advantages and AI displacing many of the things we do. What's your perspective on what the future looks like, and what a student ought to do in that regard?
It's a really interesting question, because I remember being a resident and I was in some setting where someone said, oh, 5 years from now, you're not going to use your microscope. And I kind of looked at them like, that's not okay. I'm spending a lot of time figuring out how to make a diagnosis using this thing. And what I appreciated about that is that we hear about AI and new technology and digital this and whatever, and we think, oh, this is a dinosaur, it's gone. But the truth is, I have no doubt that I'm going to be using this in some shape or form for my entire career, and I plan to work another at least 30 years, right? So, I have no fear in my job security, simply because what we do is not a black box that spits out answers. And while we are developing tools with AI, I love AI and I'm really interested in it. And I watch, just because I'm not an academic pathologist does not mean I don't keep up and watch what's happening and ask all of my colleagues in academic medicine what's going on, right? So I have friends from residency, from med school, from meetings that I've met who have a niche that they're good at. I have blood bankers who all they do is blood bank medicine on my phone, that when I get a complicated blood bank question, I text them. I say, what do I do? So we develop this network of expertise that helps us answer those questions. But as someone who sits and is that first line, this is going to be the tool I use to make that first line decision to follow up and engage some of the new technology that's out there, right? Because at the end of the day, as much as we would like to think that everything we do as pathologists is really strictly objective, it is a practice of medicine. And we are fine-tuning that practice daily. And research is happening daily. Coronavirus is a huge example of that, and how quickly we can pivot and start learning deeply into an area that we need to figure out for diagnosis and treatment and all of that. I may not be sitting at a bench trying to figure out how to make a vaccine or diagnose the post-mortem effects of COVID, but I'm involved enough and have to know enough because I've got clinicians who are working in the ICU asking me, what do I do if I want to give convalescent COVID plasma, right? So I got to know about all these things. So I stay on those developments. But even as I do that, I see that my role as being that intermediary between the new and what's happening and how it best applies to community medicine, that job's going to be there, right? So depending on what your interest is, if you want to be on the front line and you want to say, I got to know how AI is going to help us streamline our practice so we can get accurate information faster, great. There's a spot for you. If you want to add to the discussion about what we know of disease and disease progression through autopsy and forensics, there's a job for you. If you want to be like me and be that communicator or conduit for connecting new on what's coming out and what my physicians need and what is practical to do at our facility for our patients, there's a job for you. Those roles are not going to change. The tools are going to shift a little bit, but essentially that job is not going to change. And I think they'll still be using a microscope.
Yeah, I agree. I think there's a very bright future for pathology because there's so many new developments and there's such a need for just what you're describing, that interface between clinical care, laboratory medicine, testing, and all of the nuances that go along with it. And so there's a very, very bright future. Plus, we got a lot of neat toys, you know.
We do. We have great toys. It's really, I mean, it's awesome. And you know, one of my little taglines is H&E is my favorite color. Who doesn't love H&E? I mean, pink and purple together in such a way that is so intriguing. And for anybody who's wondering, this is a picture of my husband. I've got my kids up there. I've got to have him up there too.
Well, Leilani, this has been just engaging and fascinating to hear your story and your enthusiasm for what you're doing. It's easy to tell that you love your job because you love the people you work with and because you love the problems you're engaged with. And it allows you to love yourself, love your family in very important and other meaningful ways. Do you have any final words of advice or you know, wisdom that you'd like to share before we wrap this up?
Yeah, I mean, so, you know, if anybody's watching this that's a med student who's like, yeah, I don't even know pathology, I really recommend that you try to at least figure out what the lab does. Please spend a day figuring out that there's a bunch of different machines and it takes a lot of people. You know, we get med students through here occasionally. I always say, come spend an afternoon with me. We'll do some frozen sections. We'll look at a few things on the microscope and then we'll go to the gross bench and see tissue, you know, live and in person, right? And so that's always really great no matter what you go into. I like to have that time to I sort of think of it as an investment, right? Because even if you're not going to go into pathology, you will know the value you can get from your pathologist, right? When you are internal medicine doctor or when you're a surgeon, you will understand what we can do to help you. And then the only other thing I would suggest for med students who kind of think, yeah, pathology is, that's what I want to do. Invest time into your clinical rotations. You will not have another chance to see what it's like to fill the shoes of a surgeon, fill the shoes of an OBGYN or internal medicine or family practice. All of those rotations, if you invest the time in them while you're doing them, they will pay you dividends when you are sitting behind the microscope or trying to help those physicians. I look back on my med school days and I'm incredibly grateful that I wasn't sure pathology was what I wanted to do, because I did invest a ton of time in those rotations to understand their pain points and to really know what it is they worry about and care about has really helped me be a better pathologist. So it is, even if you know from day one that pathology is the career for you, invest time while you're in med school because you don't get to do that over again. And it's really, really helpful in your day-to-day practice as a pathologist. Absolutely.
Absolutely. Well, thank you so much, Leilani. This has just been delightful. I really appreciate you taking the time with us. And I'm sure that we'll see a lot of people who will see your face and be going, I'm in pathology because of what she said.
I love it. I love it. And you're welcome to share my email. I'm happy to correspond with anybody who's interested and wants to ask more questions. Like I tell my clients and other clinical staff, I may not have the answer, but I'm happy to try and help you find it. So.
Well, very good. Well, very good. Thanks again so much.